Welcome to my Dental Hygiene School experience, hosted by Dach Ska. The world of hygiene school can be wild. Hold on to your toothbrushes because we're going to dive into the chaos right now.
What's up, dental nerds? This is Dach Ska, and I'm here with another episode. Today we have an interview with Dana from Dental Hygiene Basics. We talked about many different things. I hope you get a lot of value out of it. So without further ado, let's jump right into the interview. Welcome, Dana.
Hi, welcome.
Well, for those of you who don't know Dana, she's from Dental Hygiene Basics, and why don't you just introduce yourself?
Yeah, absolutely. So thank you so much for having me on the show today. I'm a big fan of your podcast because I love anything that is supporting dental hygiene school students. I think that it's really good for people to hear other people's experiences so that they know what people are going through and then also how to tackle that themselves, right? Because we know dental hygiene school is really difficult. So my name is Dana Paladino. I am the owner of Dental Hygiene Basics. So Dental Hygiene Basics is basically, I call it an educational consulting company. My main goal is to help students get into and succeed in dental hygiene school. So you know me because we met when you were on my podcast a while back, the Dental Hygiene Basics podcast. Yeah. And you know, we really talk about how to get into dental hygiene school, how to be successful in dental hygiene school. And then I always like to showcase hygienists who have already graduated and what they're up to now so that people know going into dental hygiene school that there are multiple avenues that you can take. There's not just the clinical role where you're seeing patients day in and day out, which is the bulk of what we do as hygienists, but there are these other roles that you can pursue as well as a hygienist. So I really try and do all of that. And then of course I am an educator at heart. So I'm a national board tutor. I'm a public speaker. I do all sorts of fun stuff in the space. I'm a CDCA examiner. So I stay very, very busy year round doing all sorts of stuff. And I'm a public health hygienist. So one day a week I am practicing clinically. That's me in a little nutshell.
That's awesome. And yeah, I've listened to many episodes of your podcast, but I wanted to also explain how we kind of met just because I think it's kind of a fun story. So I was on Instagram one day and I got this message from Dana, and I had posted one of my podcast episodes. And so when you're posting for Spotify, I think it's just like one button that you press and they make this whole nice thing for you, so super easy. But with Apple Podcasts, it's not so easy. And so I learned this one little thing that I do. And so Dana, you actually reached out to me and you're like, how did you do that? And I basically said, well, it was a screenshot. It wasn't anything fancy, you know? And you're like, oh, that's cool. And then I think next you're like, do you want to be on my podcast? And I was like, I have a podcast. That's so cool. Like, yeah, of course.
Oh, that's so funny. I do remember that now that you say that because I always tell people I'm a great educator. I'm a terrible influencer. So when it comes to social media, I have no idea what I'm doing. And so when I saw you do that, I was like, I need to know how to do that.
Yeah.
And I think I had already known about your podcast because when I was researching mine, I was looking for other podcasts out there. Is there something similar? Because I didn't want to take someone's idea and do the exact same thing.
Right. Yeah.
You know, there's no point in that. Right. But when I heard yours, I was like, oh, this is totally different than what I'm doing. And so then I was like, okay, you know, you open the door and then you just ask someone, hey, you want to come be on my podcast? So it was probably a little strategic.
That's okay. I mean, that's a good way to get in the door and be like, oh, can I get your help on this? And of course, someone's like, oh, sure, I'm glad to help you. And then it's like, can you help me with this? Well, okay, you know, now I feel obligated. No, no, it was a fun way to meet you. Like I did know that before you first messaged me, you were already following my page. So, but yeah, I know what you mean about, I don't consider myself an influencer just because like I'm almost never on Instagram. And when I am, it's just like posting memes I find from somewhere else. So it's not like, I'm like, here's how to succeed in hygiene school. I'm just like, okay, here's what happened to me. Like, you know.
Yeah, but that's the way to do it because really they say we should always be helping a former version of ourselves. And that's a big reason of why I started the podcast. It was to help someone who is in my shoes or was in my, what am I trying to say? Someone who is going through what I went through previously, right? Like they help them kind of get through these trials and tribulations of getting into and succeeding in hygiene school.
Yes. So let me just get to the questions here. I have a few questions. I feel like each one could be its own podcast episode, but I mean, let's just start asking questions and see where we go from there.
Sounds good.
So I recently did an episode about difficult instructors, and so I offered a few of my thoughts, but you've been through hygiene school and you've also been an educator yourself. Tell me how you would handle that kind of situation.
Yeah, absolutely. It's a good question. And I do think that there's a shift in the climate of dental hygiene instructors. When I went to school, it was very militant, very much, everything had to fall into this like perfect line, or so we thought, right? There's always a little bit of wiggle and flexible and it within your professors, whether they show it or not, right? They do care about you at the end of the day. I like to come from this from two perspectives. One, think about the professor's perspective and what they're going through, because you're very stressed out as a student, which makes perfect sense. I've been there, I totally get it. But the professors are also really stressed out too. The instructors are going through a lot, and there's a lot happening behind the scenes that we don't always realize. I didn't realize that when I was a student, right? And I was just like, oh, why can't I do this? Or why are they giving me so much trouble with this? And looking back on it from the educator's perspective, it's like, oh, I get it now. Like there was so much that the instructors had to do, the coordination. I just remember a lot. People were always asking me, oh, can I switch my rotation? Can I go to a different place on this day because I have this going on or whatever? And I was like, you don't realize that rotation schedule took me at least 20 hours. And I wish I was kidding. And if one thing goes awry, it's like the whole thing crumbles like dominoes, right? So
Right.
it could be that, it could be something else, but we don't always realize. The other thing is early on, especially when you're learning, your instructors, they do not expect you to be perfect. And students think this a lot in pre-clinic. They're like, no, they want me to be perfect on the first try. And it's like, that is not true. Like your definition of perfect is you think you should look like us, right? Our definition of perfect is don't hurt the patient and learn how to adapt and learn how to roll, and your hands may be shaky and that's okay. Like we can see the progression of your skills. So I think that's two things that maybe just shift the perspective a little bit. Like we do want you to succeed for a number of reasons. Like why else would we be there if we don't want you to become a dental hygienist, right?
Right.
But we all know that there are some people out there who may not have as good of an attitude. They may not teach in the style that works for you. Maybe they are more forthright, more persistent, more aggressive with their approach, and that doesn't fly with you. Even though they may not mean it to be that way, that may be how it comes off to students, right? I find that it just depends on the person's teaching style a lot. A lot of people are, want that really supportive, bubbly teacher all the time. And it can be hard for everyone to be that way. So if you're having a difficult interaction with your instructor, one thing is I usually like the way that I operate is to just put it on the table. So if I'm having struggles, if I'm not feeling supported, or if I feel like someone doesn't like me for whatever reason, I will go into their office and I would say, hey, whenever we were doing this exercise together, you said this, and it just, it made me feel like I've done something to upset you and that maybe I'm not doing things the way that I'm supposed to. And I'm here to learn and I really want to learn and I want to learn from the best. And that's why you're here, right? So what can you what can I do to meet the standards that y'all are setting at the school so that I don't disappoint you, but also so that I can be the best clinician I want to be. So there's a little people pleaser in there, but at the same time, you're also deferring to them a little bit because we get a lot of pushback as instructors. And you're sitting there thinking, I've been doing this for 10 years. Like I have gone through dental hygiene school. I've taken all these training courses. Like I know what you're supposed to do, but sometimes the students will push back, And so sometimes just that respect can be enough to switch it. And sometimes the conversation, because sometimes it may not have even been about you at all, right? If it's one particular situation, that might be enough for them to realize, oh, dang, I was frustrated about something else. And that kind of came across on the student, The other thing too is when you have that conversation, it just opens the door to communication and it shows your willingness to show up and to not run from conflict, but also to approach it in a way that is respectful, because I think that it's a skill that you need to learn as a hygienist. If you're dealing with something really difficult, you have to be able to address and have that conversation. So I used to work for an employer who was very emotionally abusive, would be super nice and then flip the switch and yell at us. And I would be going to work crying, having panic attacks, super upset. Why was I still going to work? Because I had a choice, right? I could have
Yeah.
stepped away, but we all stay in things, for different reasons. But I got really good at going to the office and just explaining, this is what happened. I understand that you're upset. That was not my intention. What can we do to make this work, to, make it better? Now, dental hygiene school is usually around 2 to 3 years of your life, right? It's not going to be this where once you get out into private practice, if someone treats you like that, try and work it out or leave, right? You have that decision. But I just think that there's a lot to be said for communication when it comes to getting through these difficult interactions. I don't know. What do you think? Do you think that that would have worked in some of the situations that you've dealt with?
Yeah, I mean, communication, I think, is key for almost anything because, like, I know for some situations, like recently at my school, there was an event that kind of took over the clinic. This was a planned event, but it put a lot of extra stress on the instructors. And I feel like it kind of came through onto the students. And so the instructors are stressed out, then the students are stressed out. And then we're missing a clinic session because of this and blah, blah, blah. But like, I don't think there was any intention behind it to make our lives more difficult. It's just, this is a thing that happens every so often, and we have to learn to work around it. And, so we have to have understanding about where the instructor's coming from, like you were saying. Maybe they're just having a bad day,
Yeah.
and so, I mean, we're all prone to that. I mean, dental hygiene school, like, bad days happen. They do.
Yes, they do. Yeah. And it can, as an educator, I always try to come from a very supportive place. But there would be times where sometimes, the students would be doing something crazy that they were, like weren't supposed to do. And you're like, that you can't do an extra oral exam without gloves on, and I'm like,
Oh
we
my.
went all through, I know, and you're shaking your head thinking, but as a student, sometimes you get so stressed, you just don't think about that. And I'm standing to the side thinking like, no, 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 no. You have to put your gloves on. And it's like, oh, I didn't mean to come across as like, this is, you're breaking the law, but
Yeah.
you are kind of breaking the law of infection control. And that's what I'm here to teach you. So there can be moments where we don't react in the way that we're always proud of. And
Right.
it's not always meant to come off the way. Really, it's meant to protect you and the patient. And sometimes we can. And just like anybody, you can get frustrated with a teacher, right? Even if
Hmm.
the teacher's being nice to you, you can still be mad at your teacher, right? I would always tell my students on the first day, some days you'll love me, some days you'll hate me. But at the end of the day, I will drag you across that finish line to graduation if I have to, because that is what we're both here for, right? We both have the same goal, and that's to get you to graduation.
Now, this also makes me think of a similar situation. So, as students, we deal with difficult instructors, but what about difficult patients? I kind of mentioned before we started recording that I had a patient where it was difficult to control the conversation, really put a lot of extra unnecessary time in the appointment. So, how do you handle that?
Again, I am always the type that I am very direct. I kill everyone with kindness. Even if you're being mean to me, I will try and do everything I can to make you my friend. And that was always my thing when I got into private practice, and they'd be like, this patient, he's going to be mean. He's awful. And I'd be like, oh, I cannot wait. Like, this person's going to walk out and they're going to love me, right? They're going to try and
Yeah.
propose to me after this. I'm like, no. But I would always just try and be super kind and think through their perspective. What are they going through, right? When we get patients in our chair, sometimes they talk a lot because they're nervous. Sometimes they talk a lot because they're lonely. Sometimes they talk a lot because that's their personality. And I try and think through, okay, that's just who they are. So how am I going to be to manage this appointment? Because that room, that operatory, it is your domain. You have to be in control. And if you let someone else take control of your domain, nothing will ever go the way you want it to in a dental hygiene appointment. So in a case like that, where a patient is talking a lot, especially in a school setting, I think you can say very firmly and friendly, I am having so much fun right now, but I'm having too much fun and I'm getting a little distracted and I really need to get this done today for my requirements. So, how about we get this done really quick and I'm going to sit down, I'm going to explain everything that I found for you today. So, they know that they need to be quiet for a little bit. And then they know that you're going to walk them through everything once you're done, and just go through the whole motion and take that time to still connect with them, but it kind of puts you in the driver's seat a little bit. So I don't think that there should be any shame in explaining to a patient that, oh my gosh, okay, look at the time. I am so sorry. We've been having so much fun, but if we don't get started right now, we're not going to finish off today. And we've got to, my goal is to get you finished today. Or, oh, I could keep you here for 5 hours, but unfortunately we don't have that much time. So let me just go ahead and get in there and get started. And they may still try and talk, and that's okay. You may have to keep coming back to, okay, let's move on to the next thing. Okay. And, oh, give me 1 second. I need to concentrate while I write this down. Right. It
Yeah.
kind of breaks up that appointment a little bit.
Okay. So, and then hygiene school in general is just, there's a lot going on. I mean, not only are you trying to get your clinical skills and up to speed and, get all your requirements, but then you also have all these classes where you have quizzes, you have assignments, you have exams coming up. And so, I mean, there's a lot of for clinic, there's a lot of in clinic time that you use, but also outside of clinic. And so how do you juggle all that? I mean, that's a lot.
It is a lot, I know. And I actually just got back from Utah. I was presenting at the Utah Dental Hygiene annual session, and I was presenting to the students over stress and anxiety in dental hygiene school. And yeah, dental hygiene students are stressed. Healthcare students in general report higher levels of anxiety and stress than regular college students, and college students are reporting their stress. So this is not an individual thing that one person is struggling with. Everyone is struggling with management of their time in the program. So how do we overcome that? I really think that we have to live and die by our calendars in dental hygiene school. I think of a calendar not as something restrictive. I think of it as me planning out my day and knowing where to be, when, what's coming up, what's due, what I need to be doing each day. It helps me prioritize, and that actually reduces stress because, I have a lot of students that whenever I was teaching formally, they would say, oh, they come in, they miss an assignment. They're like, can I do it over? Can I have, can I do it as a makeup or something? I'd be like, well, I just want to know, why did you miss the assignment in the first place, right? Like in class, I reminded you about the assignment. You have a syllabus with the date, it's on Canvas. And they're like, well, I follow along with Canvas or Blackboard. It tells me when the assignments are due, but I didn't see it until it was too late or something. I'm like, or they didn't see it until the day of. And so then they missed it because they didn't have time to complete it because they were in clinic all day or whatever. So the way that I recommend getting on a schedule is like as soon as you start dental hygiene school, you buy a planner or you commit to your digital calendar and you plan that at the same time every day, or like first thing when I wake up, I'm going to get up, I'm going to go get my cup of coffee, I'm going to sit down and I'm going to look at my calendar for, on Sunday, you should be looking at it for a week to 2 weeks ahead. And then every day, it's just a part of your day. You're going to look at your calendar, and it doesn't have to take very long, right? Just 5-10 minutes to review and see where you need to be. And then make adjustments. What do you need to add in? What do you need to subtract? What needs to get done today? So prioritizing, they always say you should prioritize the top 3 things that need to get done in that day. Because if you have a to-do list with 30,000 things on it, it's like, that just gets overwhelming, right? So what are the top 3 things that need to get done? And then also what maybe doesn't need to be on your to-do list. So if you're like, get a haircut. Okay. For me as a lady, I can let my hair just grow and grow and grow and it's fine. Okay, maybe that haircut doesn't need to happen this week because that's an hour that I could be working on this project. So maybe that haircut gets pushed to Christmas break, over the holidays or something. So if there's something that's on your to-do list that's just floating, and it's like maybe a want or maybe I feel like I need to do this, allow yourself permission to dump those things off because there are things that we have to do. We can't just dump off of the list. Like projects and tests and quizzes and all that fun stuff. The other thing is plan in your schedule, like do time blocks. So you're like, okay, first thing in the morning, I have a time block for an hour. This is my morning routine. I wake up, I wash my face, brush my teeth, get dressed, whatever, pour my coffee, sit on the calendar or sit on the couch, look at my calendar. Maybe I do 10 minutes of stretching, 10 minutes of journaling, whatever it is that's going to set you up for the best day. You want to do it first thing in the morning. So, I heard this once. It's like your mornings make up your days make up your weeks make up your years, and your years make up your life. So if you have a good morning, it's going to really play out through the rest of your day. So make a plan for how you're going to spend that first chunk of the morning. And I definitely think factoring in some calendar time is a big part of that. And then you do time blocks. So it's like, okay, this is my morning routine. Then this is my commute. Then this is my, 8 to 12 in clinic. On my lunch break, I eat for 20 minutes without studying. I recommend just eating and enjoying your food. And then, study for 40 minutes, right? For the rest of the hour. And then you just plan out your day. Whenever I was presenting Claire with student RDH, she mentioned you can create a time block for anxiety. So a time when you're feeling like I just stress in this 15 minutes. This is where I think all the crazy thoughts, right? And I just am like, oh my gosh, I have to do this and this and this. And you panic. And then you just let it go, right? After that 15 minutes, like, okay, I got all the thoughts out. So I think that's really good for controlling your thoughts a little bit, because all of our thoughts are not true, right? Your brain will tell you things all the time. I'm going to fail this exam. I'm never going to become a dental hygienist. I don't know how to hold the Explorer. I can't get the distal of 2. Our brain will tell us these things all of the time. And those things aren't true. It's just things that come up, right? That's kind of how I think. It's like, oh, that's a thought. Let it pass.
Yeah.
To try not to identify too much with your thoughts, and you having that kind of 15 minutes of time to be like, these are all the crazy thoughts I've been thinking. Okay, now they're gone. Now we can focus on what needs to happen. So those are just a couple of ways. And then when it comes to preparing for exams, like once you get your syllabus, put every date in your calendar, right? If you're doing a paper calendar, use pencil because you want to write down what patient you're seeing on what day you want, so that way if that changes, you can just erase it. But you can do the same thing. There's digital calendars that you can use. You can use services like Calendly where patients can book on your calendar. So, there's different ways that you can do it to make your life easier. But you definitely want to make sure that whatever day you have listed for an exam, a project, a quiz, go in and set a reminder a week before, 5 days before, whatever the appropriate timeline is for you to finish it, so that oh, I need to start getting ready for this project. It's due in 3 weeks or it's due in 2 weeks, whatever it is that you need to do. So those little reminders help you to stay on track and help you to prioritize better.
Awesome. That was a lot of good stuff there.
I will just keep going. So yeah, we can roll to the next question.
Yeah, and I mean, my next question was kind of about managing your mental health, but you touched a lot on that. But one thing you were saying about like the anxious thoughts that people have, like, oh, I can't use the Explorer. I heard from somebody, and I don't remember who it was, but they said instead of saying I can't do this, say I cannot do this yet, and reframing how you approach things, like you said, not every thought you think is true. So yes, currently in this moment, I have trouble using an 11-12 Explorer, but in the future, after some experience, like for me, amalgams right now, I can do passable amalgams, but I don't love it, but, and then I'll be doing composites soon. And, I was just like, I don't enjoy this. And actually part of the reason why I got into dental hygiene was so I could do restorative. And, yeah, I was thinking to myself, well, at the end of semester 6, when I'm about to graduate, my skill level will be totally different. I might actually enjoy it. So right now it's just like I'm getting hung up on like, oh, I got to make sure the groove is just in the right, and make sure I get the fossa in there. And, but, in a year's time, that could be something I could do in my sleep.
Yes.
So it's just
so
framing
true.
things.
Yeah, I love that you said, I can't do this yet. One thing I always say, because students would come up to me, and this is another thing that professors are always dealing with. The student comes up and they're like, I can't do this, or I can't do this, or they're panicking about something. And I would always say, every problem has a solution, right? And maybe that's just you need more practice. That's the solution, right? You just need more time. And I think students don't give themselves enough credit for where they started and where they finished. Like, think about where you started your program. You didn't know how to even pick up a burr, right? You're like,
Right.
how do I do this? What do I push? And now you're actually removing tooth structure or however it is. I don't do restorative in Texas. We can't. So I think that's incredible about where you're going to school and all the things that you're learning. And we can learn how to do anything, but we can't expect to learn it and get it right on the first time. I mean, I failed my 11-12 Explorer, my competency exam. So I get it. I literally thought I'm never going to learn how to use this instrument. And now I just pick it up and I don't even think twice. I could use it from either direction. It doesn't even matter if I pick the right end. I know how to pick the right end now, but it wouldn't even matter. I could adapt anything on any tooth. Like, it doesn't matter. So it takes time to get there, and students really just don't give themselves enough credit. And they don't, I just wish that students would give in, like resist less to the learning process, because they what is it that the Buddha says? It's something about suffering, and we create our own suffering, right? And one way to reduce our suffering is to stop resisting what we're feeling. So you're like, I'm resisting the fact that I'm not getting this perfect, and it builds up this tension inside of you. Instead, you're like, just resist, like drop that resistance and just be like, it's okay. It's okay to feel like I don't know what I'm doing. It's okay to not be the best at this. It's okay to admit that I'm still struggling, or that I'm learning, or that I need help. And once you just give into that a little bit and you stop resisting, it's like that stress just kind of starts to melt away. And it takes practice. Like, you do it once, you're like, oh, that felt pretty good. But the more you start just giving in to those emotions, and not like having a breakdown, but just experiencing them, being like, what do I actually feel right now? Okay, I feel incompetent, or I feel like an imposter. Okay, that's how I feel. And you're just like, okay, that's it. Like, I don't have to resist. Oh, I don't want to feel that way. If you resist so much, you just get to a point where it just lives inside of you all the time. So you're just like, no, accept your feelings. And then every problem has a solution. So what's the solution? And then move on from there.
And so, yeah, that brings two thoughts to my mind. The first one, if I can remember it, was something that we were saying, like when I was in semester 2, like, we're like, we're not ready for this, but we're saying, trust the process. Like, there's been so many people that have gone through this program that, and they've been successful at it. So even though we don't understand what's going on in this moment from our limited perspective, just trust the process, like just go with it.
Yes.
The other thought I had, it was actually a video I saw online a couple of years ago. And this one lady was saying how her dad had this phrase, and he said, everything is figure outable.
Yes.
And so, like, with me, like, my patient situation was just crumbling, and I was panicking. And I wish I would have thought at that moment, like, this is figure outable.
Yes.
So, and, it all worked out in the end, which is great,
Mm-hmm.
But it's like, if I kind of take away the panic of it, then it allows me to think more clearly and deal with the situation rather than just be like, oh no, this is terrible, blah, blah, blah.
What I would always do, and you mentioned when you start panicking, you can't problem solve. And that's because when we go into panic, we go into a fight or flight mode, right? And that fight or flight is really starting to inhibit your higher level of thinking. You can't rise to your highest level of thinking and problem solving and critical thinking when you are in a state of panic and stress. So whenever students would come to me and they'd say, my schedule is falling apart, it's getting close to the end of the semester, I have these requirements left, I'd be like, okay, let's sit down. I want you to write out all the days you have left. I want you to write out the patients that you have to see. I want you to write out any openings, and I want you to write out what you can do on each of those patients, and then what still needs to get done. Okay. Then you come back to me if that plan changes, right? And they would come back and we do the same thing. Because when you start writing stuff down, it actually brings you into your prefrontal cortex, which is your higher level of thinking. So I mentioned earlier that you can schedule a 15-minute block for anxiety. What I recommend is during your anxiety time, journal. Just get a journal and just start writing. Don't even care what comes out. Just write until you feel better. Because what will happen, you'll just be writing, and eventually you'll feel that little tight ball in your chest loosen, loosen, loosen. And you start to get a different perspective because you're moving into your higher level of thinking. So suddenly the problem that started at the very first line, you're like, I'm a failure or whatever. Suddenly by the end, you should be thinking, what comes next? How do I get out of this situation that I'm in? And then just start writing down. Okay, so you write all the scary things down. Then you start writing the things you're going to do to fix it or ways that you can address it. And everything is figure outable. So I love that
Yeah.
advice. That's really good.
Yeah. So let's see. I guess one of the big questions that students always have is, how do I find patients? I know some schools find patients for you, and I think that's great. But my school, I have to find my own patients. So, I mean, on my podcast, I've mentioned things that I've done, but what do you have? What is your advice?
Yeah, I mean, if most dental hygiene schools, not most, because I've actually worked in very rural dental hygiene schools where there wasn't a high patient base, and they're getting patients, okay? I went to school in San Antonio where there's millions of people, and the students were like, I can't find patients. I'm like, there are literally millions. I said, the students out in Beeville where the population is, I don't even know. I mean, it's like probably less than 10,000. I'm like, they're finding patients. So people need dental care and people need affordable dental care. What are you except a bridge to that affordable dental care, right? And that means that you're going to have to put yourself out there and start asking patients, to come be your patient. So there's a ton of different ways. The beauty of social media nowadays is that you can post on Facebook groups, you can post on Nextdoor app, right? There's so many different ways, but you also can't forget about that one-on-one face-to-face interaction that you have with people that makes them trust you more than a Facebook post, right? You're probably going to get ghosted more on a Facebook post or on a Nextdoor app than if you go out and you physically meet someone and they connect with you and they say, yes, I'll be there, right? There's a difference. So when I was in dental hygiene school, I was at Walmart, I was at the bar, I was like anywhere handing out, I had little cards. You can also go, you could go to apartment complexes, or if you live in an apartment complex, ask if you can post a flyer on, by the mailboxes. Whenever, if you don't have a patient, walk around the school and see if there's someone who will come sit in your chair for you. Whenever I taught at one of the schools, there were other healthcare programs. So they would barter services. They'd be like, hey, okay, if you come be my patient today, then I'll come be your patient, right? And so there's just different ways that you can find patients like that. The other thing is I always tried to target the older population because a lot of them are, retired, they have more time on their hands, and they're willing to sit there, and it's social interaction. So it's a way to get out of the house. So there's different ways that you can go about that, but you could maybe go into some of these retirement communities and just say, look, I need a patient who like needs this, this, and this, and that they accept these terms. And I was always very forthright in, I'm charging you in time. I'm not charging you in very much money, but you would be helping me achieve my degree. And that's priceless, right? Like, you're going to help me start a career. And you say that sincerely, and people are more willing to help you, because people are more willing to help you if they feel like they're helping you, right?
Yeah.
And yes, there's a little fee involved, but they see you through to the end, and that makes them feel good as well. So I always try to do that, but you have to be very, very honest about the time commitment, the cost commitment, and just all the things to expect. And I very rarely had patients ghost me in dental hygiene school. And I think it was because I made those connections and I was very honest about what to expect. So that makes a big difference. Communication, it seems to be the theme of today's episode.
Yeah. Yeah, I mean, I like what you said, where it's not so much money, but more time that you're paying. And then also the benefit of them helping you out. I mean, that's something I never thought of. And I think that's just great. So definitely something I'll bring up to my future patients. So now, for someone who's listening to the podcast that they haven't been accepted yet, maybe they haven't been accepted their first time, what advice do you have for those people that are like, oh, now I have to wait a whole nother year before I can even apply again? Like, what would you do in that situation?
I love a good gap year. So, if you don't get in, a lot of people think, oh my gosh, this is the end of the world. What am I going to do with the whole next year? I think, what am I going to do with this whole next year? I have a year to get ready for dental hygiene school or for whatever it is that you're striving for. So, you know, I can speak from experience because I applied to dental hygiene school for the first time at 19. I didn't get in. So, in that time frame, I was planning to apply again the following year. I decided to go back get my bachelor's. So I graduated with my bachelor's. I became a dental assistant. I worked in oral surgery, and then I worked in pediatric dental hygiene. And then when I eventually applied again to dental hygiene school at 25, I got in. So I
Nice.
had more than 1 year off. Like, a lot of things happened in that time. But regardless of that, I think through all of those things made my dental hygiene school journey a lot easier, because the first time I applied, I had zero dental experience, right? And I hadn't taken some of these harder, like, science classes. I had taken micro and the chems and stuff, but when I went back and finished my bachelor's, I ended up with organic chemistry, biochemistry, like really, really hard classes. So, not saying that that's everyone's path, that's just my specific path, but I think that I had to go on that journey because I was not going to be ready for dental hygiene school at 19 years old. And I really truly think that the universe works in a way to protect you and put you on the right path if you see it that way, right? You have to be thinking, what's going to happen next for me? And there's so many things that you can do in that gap year to make your application better and to make you a better person, right? So go get a dental assisting license, or go find a job in a dental office, even if you're just the janitor. I always tell people, I'm like, I'll sweep the floors, I'll clean your toilets. Maybe you teach me a little bit about what's happening back there as a favor to me for doing all this. But there's always something you can do to make yourself better. And I just say, be creative in that year. Maybe you're like, okay, maybe I'm going to go travel for a year. The possibilities are really endless in what you want to do during that time. But if you think of that year as a year lost, of your life, I think you're just missing out on so much opportunity to better yourself and get prepared for what's to come.
Yeah, that's really good. I like that. So as you know, my first time around for semester 3, I didn't pass. And so I guess this kind of overlaps with your answer probably from the previous question. But if you don't pass the semester, what do you recommend? How to navigate that?
So I think it's going to depend on each person. I think the question that students maybe don't ask themselves enough when they get into this situation is, what is truly best for me? Did I get everything I was supposed to get the first time around? Like, did I put in everything I was supposed to the first time around? What lessons have I learned that would make it different a second time around, right?
Mm-hmm.
And the reason why I say that is because a lot of students think, okay, let me just jump back in, or let me remediate and be ready for the next go around, or like, there's different options that they may give you. They may just dismiss you. We don't know. It depends on the school. They may say, sorry, you're dismissed. Or they may give you the opportunity to start over from day one. Or they may say, okay, you, like in your situation, okay, you're going to come back in term and redo term 3, right? So I would, if this were me, and I'm speaking from the experience of being an educator who's had several students who have failed out and then had to make this decision. If it were me, I would really be thinking about, if the opportunity were given to start back over from the beginning, would I take it? And that would be my choice personally, because the deficits usually don't start like when the failure happens, if that makes sense. Usually
Mm-hmm.
the deficit starts pretty early on. And I think if we can go back and rebuild that foundation, it really helps the student to succeed. Now, there are going to be, again, this is a very personal decision, because if you go back to square one, you are going to pay more money, right? You're paying for more semesters. And I totally get that. But then I think, what is the long term chance of reaching that success, that end goal? I think that most people, it would be better to start back at the beginning. Now, that's going to be very dependent on the person and their unique situation as well. The other thing too is just really taking a good look at where you were, because like I said, that deficit usually doesn't just start early. It usually doesn't start like when the problem happens, right? So a lot of my students who ended up failing out, they were on the borderline like the whole time. It was like okay, that kind of 70, like if 70 was passing, you know, it was like 70, 71,
Yeah.
like in every class. And you have to think through, how is that going to impact when you take your board exams? Like when you're hovering on that edge, you may be hovering on the edge as well for the board exam. So we want to make sure that you're going to be in the most successful spot when it comes time to graduation, because there are other exams post graduation, the boards, the clinicals. So you really want to make sure that you're set up for success for that. And again, if it's a gap year, we can always do things to make ourselves better in that gap year. And I think, you know, making sure that you're still studying, making sure that maybe you're looking into a tutor or something to keep your skills as fresh as possible, because I mean, we talked about this a little bit before we started recording, but anytime you're out of something for a length of time, it does get more challenging when you have to go back in. And you also mentioned that people expect the same level. They expect you to be on the same level that you performed at previously, but it's been this time frame, right? So it takes time to get back into the swing of things. So anything you can do in that time off to make sure you're staying on top of your skills is going to be beneficial. And I wish that there were more, I feel like I would call them rehabilitation programs, right? It's like, okay, this is what happened. Now we need to almost get you ready to come back and start again, because every student I've had has had that same experience where it just takes time to kind of get back into the swing of things when they come back.
Yeah, I remember my first day back. My biggest problem was I couldn't log onto the computer. I didn't remember like the structure of like the password and all that stuff. And I'm like, I was more worried about like, you know, getting technical things down. And this is like the computer standing in my way right now. Like,
Yes. And it seems so
so
small, but those small things are friction points to your day, and it's like they build, you know, because it's like it
yeah,
starts with the computer. That's not working right. You can't get in. You start to get frustrated, and then you start, you know, all those doubts start creeping in. Oh, and it all starts with you can't log in, right? It's like all the little things like, oh my gosh, what am I doing? So I totally get it.
So the last question I have here is kind of about dental injuries. And so that's a very broad topic because, I mean, there's the injury of just, you know, posture, like improper posture when you're working, but then there's also instruments. I mean, we're working with very sharp objects. But I'll just kind of share a quick story that I experienced. So we were working in pre-clinic, so we're working with classmates rather than patients. And I had just opened up my instruments, and the first thing I do, I poke myself with my instrument. So it was clean,
Okay.
but at the same time, it's like, I know better than this. And so, of course, like I'm bleeding, so we're trying to take care of it. And so one of my other classmates who did not have dental experience wasn't aware of the protocol. Like, because I've been in the dental field for over 10 years now, I I knew like, okay, this we need to get rid of this now, like put my instruments in sterilization. But she didn't realize it, and so someone had to tell her. And that's not her fault necessarily. Like she didn't know, um, but like there's a lot of safety precautions that need to go into dealing with those sort of situations. And I have another dental injury now that I think about it too. I had a patient who had COPD, and so she wasn't able to lay back all the way. And so someone had told me, so when you work on this patient, I was working on the upper left too, like probably I'd say the hardest quadrant, right?
Yes. Yeah.
So, and like I was getting near the end of the semester, I was stressed out, and I was like, I'm not going to worry about my posture. Like, I just need to get this done. So, I had actually been like tilting, putting a lot of weight on my knee, and like this was just for like 2 hours,
Mhm.
and I was just, instead of like using indirect vision, I was like, I don't have time for that. I just went for it. And that was like a year and a half ago, and my knee's okay, but if I don't take care of my knee, it starts hurting. Like these are the things that people don't necessarily think about that can have long-term impacts. So why don't you talk a little bit about dealing with dental injuries and like prevention and all that?
Yeah, that's such a good topic to bring up, because preventing injury should start from the day that we walk into dental hygiene school, because we already know that we are at risk for injury in our career, right? That's one of the first lessons in pre-clinic is they talk about the musculoskeletal disorders, or at least they should introduce you to the fact that we're at risk for neck, back pain, carpal tunnel, wrist, finger, hand, anything. Like there's so many different types of little syndromes that we can be exposed to and be diagnosed with, especially because we sit in the same position all day long. We have really static postures. We do tiny motions, and we require strength as well to remove calculus. So there's just a lot of things that can add up. And then you mentioned sometimes we're bending or turning in ways that we shouldn't. Well, I think the first thing when it comes to injury protocol, you mentioned the scalar stick and people not being aware, and really that should fall on the school to make sure that y'all are comfortable with the protocol. And sometimes the faculty is not comfortable with the protocol. And I can say this because I've been new faculty so many times that you're like, okay, like what I know what I would do in this situation, but what is the protocol for the school? And that's going to also be true when you start working in an office. Like those are the conversations that you really want to have within the first week. Like, what do we do if this happens? Where is this located? Who do we call in this situation? Do you have a protocol? If they don't have a protocol, I'd be a little nervous, right? Because it means that when things go awry, no one's going to know what to do. And you should have someone in the office who's in control of that. So with that being said, I think for injury, the number one thing I would recommend, whether it's preventing a needle stick, preventing a scalar stick, preventing harm to yourself, via bending and twisting in weird ways, is to take a deep breath and slow down a little bit. So I know this because this is how I am, right? I'm like, okay, I got to hurry up and get my instruments open, and there's only so much time in the appointment and every second counts. And that is true, but we need to work smarter and not harder, and we need to not hurt ourselves in the process. So I really slow down when I'm setting up my stuff, right? It's like I can wipe really fast, because wiping something down, you're not as likely to injure yourself. But when I open my instruments, I open them really slowly. I set them out just so that they're in a way that it's like organized on my tray. So my tray is typically very clean and organized so that I don't reach down and accidentally poke myself because I can't see my scalars because they're covered in gauze or something like that, right? So keeping things organized, slowing down during your setup, and then every time you go to do something that could potentially injure you, like pick up a scalar, just pick it up and just take a little breath, like a little exhale. And it also helps to kind of ground and focus you. I know for me, I tend to get in my own head. I'm thinking, I need to do this, then I need to do this, then I need to do that. So mentally and physically, my body is moving way faster than it should be. Like your body can really only move at a speed that like I can only walk from here to the next to my next patient as quickly as my legs will move, right? But I can slow down my mental thoughts in that moment. So taking a moment to kind of decompress. When you pick up your scalars, you're like, the only thing that matters right now is me flying into my patient's mouth, landing a fulcrum, and not hurting anyone in the process, right? Like, so I think that that's a really good way to bring more awareness to your day, to bring more mindfulness, to have a moment to kind of decompress. I always tell my students, when you pick up your instrument, that's your Zen moment, right? You're like, okay, now I'm just going to focus on what needs to happen. Right now, the only thing I need to do is probe. Right now, the only thing I need to do is get this instrument on the tooth, remove the calculus, right? So just taking a moment and really thinking about where you are and what you're doing. Okay, so focusing, not getting distracted by the other things that are happening or that you need to be doing. The second thing for injury, and I know y'all hear this all the time, but the patient is only there and once you graduate, especially for maybe an hour, and you're there 8 hours a day or however long your clinic session is. So we really do have to prioritize ourselves and our posture. And so, when you catch yourself getting into these positions, make the adjustments now. Now, there's going to be certain situations that unfortunately, like if your patient's in a wheelchair or if they can only sit upright, but that's not good for us, right? Like that they're always like, no, the patient should adjust to you. But like realistically, there are times when the patient cannot adjust to you. And so if that's the case, you need to take regular breaks. You need to be stretching, switch it up. Maybe you only do 2 teeth on the upper left, and then you're going to go somewhere else that's easier. And then you go back, right? So that you're not staying in that static posture for 2 hours, injuring your knee, because it happens so fast. I always like to tell the story. I got injured 2 weeks after graduation, or not 2 weeks, 2 months after graduation. I had 3 ways of adjusting my chair in my operatory. And so I could use there's on the bracket table, on the tray table, there's a button to lay them back. There was a foot pedal on the floor, and then there was a button on the side of the chair. So I kept bending over and pressing the button on the side of the chair, and I would hinge to the right every time, every time. I got to where I physically could not bend to the left. Like
Oh
I went to the
no.
chiropractor and they're testing my range of motion. I could go I could bend one way and then I couldn't bend the other. It's so silly, right? And then the other thing that happened to me was, and it's a chronic injury now that irritates me a lot. I would chicken wing my left arm out and I would retract with my left arm so much. And then I was commuting 30 minutes to an hour, depending on traffic. So I would get in the car, elbows up, holding the
Oh
steering
no.
wheel. So I would drive, I get to work, my left elbow's up. I'm working all day, retracting, get back in the car, elbows up, right? So my elbows were up. I mean, way too many hours in a day. And so I still get pain down the left side of my neck and through my shoulder blade. And it, I do it like if I sit on my computer, I'll like rest on my left shoulder. I'm like, no, don't do that. So sometimes it's also more than just the clinic. Look at your life outside and see if there are things that could be potentially irritating it or making it worse. And that was something I didn't think about for a long time. How do my other daily habits, the things that I do, if I'm on my computer a lot, am I protecting my wrist on my computer now? Because then tomorrow I'm going to go into the elementary schools and I'm going to be retracting and using my wrist. So it's never just one thing that can cause the problem. I mean, in dental hygiene, it can be one thing, but look at the rest of your life under a microscope as well. I always say, make everything as easy on your hands and your neck and back as you can, and take very good care of yourself. Yes, you will have student loans. Yes, you're going to have money to pay, but if you can't work because you're in pain, then that's not going to be the right way to tackle that, right? So get the massages, go see a chiropractor, stretch every morning, foam roll, like do all the things. Just make that a part of your daily life so that you can hopefully prevent injury or, manage it if you do end up having one.
Yeah. Yeah, that's all really good. This was definitely a lot of good discussion here about many aspects of dental hygiene, school and clinically. So I thank you for all your inputs, and this was definitely valuable. So I appreciate that.
Absolutely. Thank you, Jack, for having me on. I love your podcast. I love what you're doing for dental hygiene students. So yeah, if you ever have more questions, just, I'm here for you guys. So
Yeah.
you can follow me on Instagram at Dental Hygiene Basics. You can email me anytime, info@dentalhygienebasics.com. My true passion is helping students. So, I mean, I get random questions all the time and I love it. So please feel free. Ask me all the questions.
Awesome.
Yeah.
Well, again, thank you so much for being here. Maybe in the future we'll have you back, and maybe if I think of more questions, I'll pick your brain.
Good. I love it. All right. Sounds like a plan.
All right. Thank you.
Okay. Thanks, Zach.
Thank you for listening to my dental hygiene school experience. You can find Dach on Instagram and TikTok by searching for dachska.dental. If you have questions for Dach, you can send him a message on Instagram or TikTok, or you can email him at dachskadental@gmail.com. Our host is Dach Ska, and I'm the announcer, Nigel, telling you to stay nerdy and brush your teeth.